Hello, my name is Daniel Trujillo, and this is my care navigation assignment for COH100. And the topic that I chose for my three sources is asthma. So, starting off with the 2022 article from the National Library of Medicine, this specific source focused on clinic navigation and home visits to improve asthma care in low income adults. And this study obviously addresses disparities in the transportation aspect of care navigation before and after the effects of the pandemic, since obviously people were using more or less healthcare resources during that time, as well as going out more or less, likely less for most people. And the article also discussed or focused on patient preparations for going to a doctor's office, as well as addressing some of the barriers to managing their asthma, as well as care navigation barriers for the individual, with the hopes of creating a better form of access to care for those patients. And one example of this is people here in Muncie who live in rural areas often are lower income and have less reliable means of transportation. So having a healthcare resource next to them is not really a possibility oftentimes. So the having at-home visits alongside trained healthcare workers could do a good job of minimizing the amount of times a patient would re-enter a hospital for any at-risk asthma-related issues. And with enough resources, I think care navigators could provide this not only on an individual level, but as well as a community level, since oftentimes low-income areas are typically not just one house, it's pretty much a general area nearby. So I would also encourage others to maybe even share feedback on their own specific situation and barriers to care navigation, which could help develop a better understanding of what's going on within a specific low-income community. For my second source, this is from the Journal of Allergy and Clinical Immunology from 2016, and this is a care navigation tool that assesses asthma self-management and health literacy. And this specific source I really like, since its main focus is to address barriers of individuals in low-income areas regarding inhaler use and knowledge of the benefits and other related things to inhalers. The study involved the 21-item questionnaire that was developed by care navigators in the study, and the study looked to identify if any individuals had barriers on how to effectively use their inhalers and other inhaled corticosteroids to their fullest potential. This study specifically, the 21-item questionnaire, was used to identify what level of knowledge the patients had in terms of education towards inhaler use and things related to that. Care navigation played an important role into identifying barriers of both using inhalers and understanding the benefits of inhalers. I think the article did a great job of addressing the fact that not everyone is going to have the health literacy to understand the benefits of using an inhaler or how to use it properly. Things like storage and how to use it, the different forms of inhalers that you have, are all information that likely a doctor isn't going to sit down and explain completely to you. So you might not have the fullest knowledge, and you might not be using an inhaler to its fullest extent if you don't have an idea of how to properly use it or what the benefits are. One example of this is that I personally had an inhaler when I was younger. I would often get really sick frequently, and I would cough a lot, and that really affected my lungs as a kid. So I would have to use an inhaler with this tool attached to it that sounded like a harmonica, and I would know I was doing it right when the noise of the harmonica would play, and that would let me know I inhaled the inhaler properly, or at least effectively to some degree. And but my mom also had language barriers in terms of healthcare providers, and that made it difficult to really understand what exactly the benefits were of having an inhaler. So that was, as a kid, that was a blurry line for me. So also for my mom, since English is not her first language, so that was we would often have to have translators or some assistance that sometimes wasn't there, but other times was, fortunately. And for my third and last source, this comes from the National Library of Medicine again. This one is a 2017 article that focused on the role of patient navigators in improving and managing childhood asthma better. And this specific study addressed the barriers of asthma management in children. And specifically, care navigators wanted to identify some of the asthma triggers that students might have in an environment or children might have in an environment, as well as appropriate use of preventative asthma medication. Sorry. And with this information, care navigators would create more individualized plans to better suit each child's needs. And this specific study not only addresses the barriers of preventative asthma care, it also discussed how care navigators made sure to address and resolve any language barriers during the evaluation period, since a lot of the population within the study didn't, or English wasn't their first language. So they would have to have translators to come in and adjust the evaluation period to better suit the children's needs and the parents. An example for this, I mean, my girlfriend has asthma, and growing up, she often talked about how there was language barriers as well as how to manage her symptoms of asthma. She lived in a lower income neighborhood pretty close to where I lived when I was younger as well, and she was frequently exposed to things like secondhand smoke, which obviously can trigger asthma symptoms in some children, and she was one of the people who that would trigger her symptoms. So that was definitely an applicable source that I was familiar with from her. And all these articles do a great job of addressing different barriers to asthma. Obviously, I have loved ones in my life who have asthma, as I've discussed, and so I really want to get more knowledgeable on the subject in general. And oftentimes, you don't really know off visuals who has asthma and what exactly would trigger those symptoms. So being more conscious of that, I think, is always a good thing to do. Articles like these, I believe, do a good job of addressing those situational barriers across different contexts and different barriers of life. And that's it for me. Thank you.